Welcome to my channel. Don't forget to like and subscribe. Thank you.
Lymphoma is a type of cancer that originates in the lymphatic system, a crucial part of the body's immune system. This system is responsible for protecting the body against infections and diseases, making it an essential component of our overall health. The lymphatic system is a network of vessels and nodes that carry lymph, a fluid containing infection-fighting white blood cells called lymphocytes. These vessels and nodes are spread throughout the body, forming a complex and extensive network. These lymphocytes travel throughout the body, identifying and destroying harmful invaders like bacteria and viruses. They play a critical role in the immune response, ensuring that the body can effectively combat infections and other threats. When lymphoma develops, it disrupts this intricate process, affecting the body's ability to defend itself. The cancerous lymphocytes can grow uncontrollably, leading to a range of health issues. The lymphatic system plays a vital role in maintaining fluid balance in the body, collecting excess fluid from tissues and returning it to the bloodstream. This process helps to prevent swelling and maintain proper circulation. It also absorbs fats and fat-soluble vitamins from the digestive system and transports them to the bloodstream. This function is crucial for the body's ability to utilize essential nutrients and maintain overall health. Lymph nodes, small bean-shaped structures located throughout the body, act as filters, trapping and removing foreign substances and waste products. They are an essential part of the immune system's defense mechanism. When lymphocytes become cancerous, they multiply uncontrollably, often accumulating in the lymph nodes and causing them to swell. This swelling can be one of the first signs of lymphoma and may be noticed during a physical examination. This uncontrolled growth of lymphocytes can lead to a variety of symptoms depending on the type of lymphoma and where it originates. Common symptoms include swollen lymph nodes, fever, night sweats, weight loss, and fatigue. The lymphatic system is spread throughout the body, so lymphoma can develop in various locations, including lymph nodes in the neck, armpits, groin, chest, abdomen, and other areas. This widespread presence means that lymphoma can affect multiple parts of the body simultaneously. As the cancerous lymphocytes accumulate, they can interfere with the normal functioning of the lymphatic system and other organs. This interference can lead to complications and further health issues, making early detection and treatment crucial. Understanding the lymphatic system is essential to comprehending how lymphoma develops and progresses. By learning about this system, we can better appreciate the importance of early diagnosis and effective treatment strategies. This complex network of vessels and nodes plays a vital role in protecting the body from infection and maintaining overall health. It is a key component of the immune system, working tirelessly to keep us healthy. When lymphoma disrupts this delicate balance, it can have significant consequences for the body's ability to fight off disease. Treatment options for lymphoma vary, including chemotherapy, radiation therapy, and targeted therapies, all aimed at restoring the body's ability to combat the cancer and maintain a healthy immune system. Lymphoma is broadly categorized into two main types, Hodgkin lymphoma and non-Hodgkin lymphoma. These two types of lymphoma are distinct in their characteristics, origins, and the way they spread throughout the body. Understanding the differences between them is crucial for accurate diagnosis and effective treatment. Hodgkin lymphoma is characterized by the presence of Reed-Sternberg cells, large abnormal lymphocytes that are readily identifiable under a microscope. These cells are a hallmark of Hodgkin lymphoma and are not found in non-Hodgkin lymphoma. The identification of Reed-Sternberg cells is a critical step in diagnosing Hodgkin lymphoma. Non-Hodgkin lymphoma, on the other hand, encompasses a diverse group of cancers that lack Reed-Sternberg cells and exhibit a wider range of characteristics. This group includes many different subtypes, each with its own unique features and behaviors. The diversity within non-Hodgkin lymphoma makes it a more complex category to diagnose and treat. Hodgkin lymphoma typically originates in the upper body, often starting in the lymph nodes of the neck, chest, or underarms. This predictable pattern of origin helps in early detection and diagnosis. Patients may notice swollen lymph nodes in these areas, prompting further medical evaluation. It tends to spread in a predictable pattern, progressing from one group of lymph nodes to the next. This orderly spread is a distinguishing feature of Hodgkin lymphoma and aids in staging the disease, which is crucial for determining the appropriate treatment plan. Non-Hodgkin lymphoma can arise in various locations throughout the body and can spread more unpredictably. This unpredictable spread can make it more challenging to diagnose and stage. Non-Hodgkin lymphoma can affect lymph nodes as well as other organs, such as the stomach, intestines, or skin. The distinction between Hodgkin and non-Hodgkin lymphoma is crucial because the two types have different treatment approaches and prognoses. Hodgkin lymphoma often responds well to treatment, while non-Hodgkin lymphoma requires a more tailored approach due to its variability. Hodgkin lymphoma, while still a serious cancer, is often highly curable, even in advanced stages. Advances in treatment have significantly improved the prognosis for patients with Hodgkin lymphoma, making long-term remission and even cure possible for many. Non-Hodgkin lymphoma encompasses a broader spectrum of diseases, some of which are indolent, meaning slow-growing, and others that are aggressive, meaning fast-growing. The treatment strategy for non-Hodgkin lymphoma depends on the specific subtype and its behavior, requiring a personalized approach. Understanding the specific type of lymphoma is essential for tailoring the most effective treatment plan. Each subtype of non-Hodgkin lymphoma may require different therapies, ranging from watchful waiting for indolent types to aggressive chemotherapy for fast-growing types. The diagnosis is made through a biopsy, where a small tissue sample is removed and examined under a microscope to identify the presence or absence of Reed-Sternberg cells and other characteristic features. This biopsy is a critical step in determining the exact type of lymphoma and guiding the treatment plan. This information, along with other diagnostic tests, guides the treatment strategy and helps determine the overall outlook. Additional tests may include imaging studies, blood tests, and genetic analysis to provide a comprehensive understanding of the disease and its progression. Lymphoma can manifest in a variety of ways, and it is crucial to be aware of the potential signs and symptoms. Some individuals may experience no noticeable symptoms in the early stages, making it difficult to detect without medical intervention. However, as the disease progresses, certain signs and symptoms may become apparent, signaling the need for further investigation. One of the most common symptoms is painless swelling of the lymph nodes, typically in the neck, armpits, or groin. These swollen lymph nodes may feel like small, rubbery lumps under the skin and can sometimes be mistaken for other less serious conditions. It is important to monitor these lumps and seek medical advice if they persist or grow in size. Other common symptoms include persistent fatigue, which can significantly impact daily activities and overall quality of life. Unexplained weight loss is another red flag, as it may indicate that the body is using more energy to fight the disease. Night sweats, which can drench your clothes and sheets, and fever are also common symptoms. These can be particularly distressing and may disrupt sleep patterns. Chills and itching are additional symptoms that can occur, often without an apparent cause. Itching can be widespread or localized, and may be severe enough to cause significant discomfort. Some individuals may also experience chest pain, shortness of breath, or abdominal discomfort. These symptoms can be particularly alarming and may prompt immediate medical attention. It is important to note that these symptoms can be indicative of other conditions as well, so it is crucial to consult a healthcare professional for a proper diagnosis. Early detection and diagnosis are key to managing lymphoma effectively. In some cases, lymphoma can affect specific organs, leading to localized symptoms. For example, lymphoma in the stomach may cause abdominal pain and nausea, which can be mistaken for common gastrointestinal issues. Persistent abdominal pain and nausea should not be ignored, especially if they are accompanied by other symptoms of lymphoma. Similarly, lymphoma in the lungs may cause coughing and shortness of breath. These respiratory symptoms can be particularly concerning and may be misdiagnosed as other respiratory conditions. The specific symptoms experienced can vary depending on the type of lymphoma, the location of the affected lymph nodes or organs, and the stage of the disease. Understanding these variations can help in recognizing the signs early and seeking appropriate medical care. It is important to remember that not everyone with swollen lymph nodes has lymphoma. Lymph nodes can swell in response to infections and other inflammatory conditions, which are often less serious. For instance, a common cold or flu can cause temporary swelling of the lymph nodes as the body fights off the infection. However, if you experience persistent swelling of the lymph nodes, especially if accompanied by other symptoms such as fatigue, weight loss, or night sweats, it is essential to seek medical attention to rule out lymphoma or other underlying causes. Early consultation with a healthcare professional can lead to timely diagnosis and treatment. improving the chances of successful management of the condition. The exact causes of lymphoma are not fully understood, but several factors have been identified that may increase the risk of developing this disease. These risk factors include a weakened immune system, certain viral infections, exposure to certain chemicals and radiation, and a family history of lymphoma. Individuals with autoimmune diseases such as rheumatoid arthritis or lupus may also have an increased risk. Certain viral infections such as the Epstein-Barr virus or EBV and human T-cell leukemia virus type 1 or HTLV1 have been linked to an increased risk of developing certain types of lymphoma. EBV is a common virus that causes infectious mononucleosis or mono, and HTLV1 is a retrovirus that can cause adult T-cell leukemia/lymphoma. Exposure to certain chemicals such as pesticides and herbicides and exposure to radiation, including prior cancer treatment, may also increase the risk of lymphoma. Having a family history of lymphoma suggests a genetic predisposition, although most cases of lymphoma are not directly inherited. While these risk factors can increase the likelihood of developing lymphoma, it is important to note that most people with these risk factors do not develop the disease. Furthermore, many individuals diagnosed with lymphoma have no known risk factors. Research continues to explore the complex interplay of genetic and environmental factors that contribute to the development of lymphoma.